As we continue our preparation and looking at whether or not people need to do a spike detox, I am analyzing how disease presentation occurs, especially around the spike protein. As I said before, this is a critical part of our understanding. Spike detox. Does everyone need one? This is a presentation coming up in little under a week. If you are interested, please click on the link below to join in this session. It's an important question and one that needs some clarity of thought. So, today I'm going to be taking on a very unusual condition, and I like to give credit to where I see these things. And this came from a newsletter, Thailand Medical News. Doctors link rare autoimmune lung disease with antisynthetase syndrome, COVID infection, and vaccination. And it really caught my attention because it fits with what it is that I am looking for in the context of the COVID storm. I am looking for how infection, vaccination, spike protein all interacts to create this really unusual pattern that I call the COVID storm, where you have mild initial symptoms, but underneath the iceberg is chronic immune activation and something that we really need to try and address. So, this is essentially what I am after and what I'm trying to see if I can figure out. So, as we go through, I'm going to be taking you through some slides to help you understand it. And since today is a Friday, depending on when you have watched it, I am potentially going to try round two of Talk to the Public. So, if you are listening and you have something sensible to say, question to ask, no inappropriate terminology, I'll give you a link after I've finished the presentation, and you should be able to join me and ask the question. So we'll come to that at the end. But let's start off with a few important things that I think that we need to understand with this condition. And I'm going to share with you what this paper was about. And this is it here. And it is looking at anti-PL7, PL12 antisynthetase syndrome associated with interstitial lung disease following infection and vaccination. Case reviews. This was from Spain, and this was recently published. And it's good to see people tackling some of these important topics. And I'll take you through what they mean about interstitial lung disease. But just a few simple points that I think I want to highlight is when you think about what is this syndrome, it's important to get the basics right with it. So, antisynthetase syndrome is a subgroup of idiopathic meaning we don't quite know the mechanism or the cause, inflammatory, that's inflammation, myopathies, that usually deals with muscles. So it's a subgroup of idiopathic inflammatory myopathies, and it's associated with specific autoantibodies. And the symptoms are the primary symptoms are what we call a triad. So three things: arthritis, this is joint pain, myositis, inflammation in the muscles, and interstitial lung disease, inflammation and fibrosis in the lung. Additionally, there are other things like Raynaud's phenomena. That's where people's hands go quite cold and blue in the if they're in the cold, and fever have also been associated. So it's an unusual and relatively rare condition. It's not something I have come across, or if I've come across it, I've not known that was what it was. This is part of the problem. It's important to note when you are thinking about these conditions is that very often you don't see a textbook presentation, and people may present with different pieces of the puzzle. Some people may have more myositis, some people may have more arthritis, some people may have more interstitial lung disease. The lung disease is critical because it's because people can't breathe. This is why they oftentimes end up having much more detailed investigations done. So within the spectrum, you may realize that many other people could have some manifestations of it or a similar kind of condition because many of these autoimmune diseases overlap. The question is, what is the connection with regards to the spike protein. And in case you're just joining me here, this is all preparing for spike detox. Does everyone need one? Look at the webinar link below and join me as I try and figure out what it is that we need to do. So let's get into some slides about what really is lung fibrosis. So here we have a situation with a normal lung. So this is just a man. You can see his windpipe here, and it splits to have, you have two lungs, a left lung and a right lung, and it sits on top of the diaphragm. And this is where you breathe, and this is how you exchange oxygen, and you do it all the time. And the surface area of these lungs is about half of a tennis court. So it's very big. And when you break it down, you can see here that these all break down into bronchi, bronchioles, and they then end up in very tiny sacs called alveoli. And you have about 480 million of these in your lungs. And this is the impact. This is what a healthy lung looks like. And each one of these air spaces is then attached to a tiny capillary blood vessel, and it exchanges oxygen and carbon dioxide. So oxygen comes in, carbon dioxide goes out. And this is what your lungs do all the time. And in order for you to survive, you need healthy lungs. Now, in lung fibrosis, you then have an alteration in the normal architecture of the lung, and it would look something like this. So in the previous one, instead of everything looking nice and smooth, they're now quite tight, and it's kind of like a balloon that has been blown up a lot of times. It's now very stiff. It doesn't exchange oxygen as well. You can see here that instead of the nice smooth architecture, you have a lot of fibroblasts which are putting down collagen, and so the lung is stiff, doesn't expand as well, and all of this impacts on lung exchange. And very often for people who have lung fibrosis, they have difficulty breathing, limited exercise tolerance. Don't assume that just because you have limited exercise tolerance that it's lung fibrosis. There are lots of things that can cause shortness of breath. Lung fibrosis is just one of them. But when we come now to viral infections and autoimmunity, just a reminder that this is nothing new. I've shown this slide on many occasions that viral mediated autoimmune diseases are not uncommon. There are many diseases like this: multiple sclerosis, type 1 diabetes, rheumatoid arthritis, and then in red are the different viruses that can call it: Epstein-Barr, Coxsackie virus, CMV, varicella zoster. In time, in probably another 10 years, when we're talking about viral mediated autoimmune diseases, you're going to find that COVID is in almost every single one of these categories, because as far as I can see, it is probably one of the most effective viruses at causing all kinds of autoimmune problems. That's why I'm talking about the spike detox, because it's not the virus per se, it's the spike protein interacting with the body's normal proteins that seems to trigger these very unusual patterns. So, what is the connection in terms of these patients who have had it? So, I'm going to take you through, before I explain any more, I'm going to take you back to the presentation for you to see what these cases look like. This is how it presents. Here you have these cases. This is the clinical information. It gives you 4 cases: 1, 2, 3, 4. Shows you their age 60, 55, 69, 63. Interestingly, all of them are female. And females tend to have a higher risk of autoimmune conditions. But I want you to notice as well, very carefully, that this female, case 1, had a background of autoimmune hypothyroidism. Remember this. I'll come back to this. In this person, they had dermatitis, inflammation, psoriatic dermatitis, and sarcoidosis, another autoimmune condition. This person in case 3 again had autoimmune hypothyroidism. This person had a long history of smoking, had some unusual periorbital, that's around the eyes, facial eczema, and you must therefore just remember the eczema. This one, dermatitis and sarcoidosis. This one still had eczema. I'm highlighting this because these are largely inflammatory conditions and in some cases, pre-existing autoimmune conditions. So let's follow along with regards to what happens in terms of vaccination. Here you have, and this is great, when studies give us this information that we can assess it. These were all vaccinated. This one had 3 doses up to June of 30th, 2021. This one again had 2 doses up to November 2021. This one had 1 to 3 doses up to January of 2022. And this person again had 3 doses up to February of 2022. Now, in the first case, they had their inflammatory process start after the vaccine. So 14 days after the second dose. And the second one, it's 10 days after the second dose. Now, I'm just highlight an important point to you is that many people have these symptoms and they make no connection to the vaccine because they've forgotten that they've had it. They don't even think of it as an intervention. That's a problem because any symptoms that you have within about 28 days, if you don't have a very clear reason for it, you would or should consider whether or not it could be related to the shot. That's just simple clinical medicine. If it's a medication, if it's a jab, if it's anything, you should at least consider the possibility. Back to the paper, and you can see for these two people, this is case 3 and case 4, 1 day after SARS-CoV-2 infection, 1 day after SARS-CoV-2 infection. So what we're seeing here is 4 cases where 2 are caused by infection, 2 are caused by vaccination. What that tells us is that the critical link is the spike protein. The spike protein is the problem. And as I said, just reminding you as we go along that in the context of the spike detox, this is why I'm talking about it. Join me in this journey. This is very, very important information that we have to work through. So as we get back to the principles, you can see 2 were vaccinated, 2 were from infection. Everything is connected with the spike protein. What kinds of symptoms did they have? Dyspnea or shortness of breath. This person had muscle aches, Raynaud's, that's where the fingers go blue in the cold. And this person had shortness of breath, a bit of fatigue and temperature. This person had shortness of breath, fever, and joint pains. This person had shortness of breath, joint pains, muscle pains, fever, and Raynaud's phenomena. So you can see the critical common factor is a shortness of breath. And this shortness of breath is probably what got them mostly investigated. What I'm highlighting here is that very often, some people may not have significant shortness of breath, but have more fever and polyarthritis or myalgia. In those cases, it's far more difficult to diagnose. And so this is why I know that it's very likely that we have a lot of people with underlying conditions that may not have been properly diagnosed. As we look back at the information, it points out here that they had pulmonary fibrosis in all of them, as well as pneumonia. It looks at their blood tests. We'll not go into it in too much detail, but just interestingly, their D-dimer, that means their clotting mechanisms, you can see here 215 to 500 is normal, 4 times above normal, 4 times above normal, about 3 times above normal. For this patient, it was normal. That's quite significant because it does suggest that the D-dimer could be a useful screen in terms of picking this up. Their inflammatory markers were not elevated, and in only one of them did they have a significantly elevated ferritin. That's useful and something that I tend to look at. But when you look at all the autoantibodies here, this indicates that they have an associated autoimmune disease. And it's sometimes very difficult to diagnose a specific autoimmune disease. And oftentimes, if you're not sure, just screening for autoimmunity can be quite significant. So taking you back now to the slide, the question is, why did this happen? And as I highlighted in these cases, all of them had some kind of inflammatory process in the background or an autoimmune condition that was pre-existing. This is how it works with regards to the spike protein and many of these conditions. Watch this sequence of steps. The first thing you have to know is that the virus can infect lymphocytes. It uses CD147. That's an entry receptor that's on lymphocytes, and so the virus can get into them. We've found that it doesn't really cause productive infection, meaning that it doesn't go on and replicate and infect other cells, but it does have an impact on how this lymphocyte can actually work. And when we look at the affected lymphocytes after a COVID infection, CD8 cells are down, CD4 T cells are down, B cells are down, natural killer cells are down. So, an important factor that I keep on highlighting is that even a mild infection is doing damage to immunity, and it will have an impact on how the body does function in the future. So it's an important point to try and remember when we think about these things. Now, once you have an infection in these lymphocytes, this is now where, if I can get this to work, this is not working, so you'll have to just look at the slideshow with me. You'll see the full slideshow, but I'll show you this here. When it's not working properly, what then happens is it infects these lymphocytes and then they become almost asleep. They're still present, but they're not working properly. Now, this is where we have to get into more detail about the kind of lymphocyte that's affected. This one is talking about regulatory cells, and I'm coming back to this now. So, in order to understand how the in order to understand how it works with regards to immune cells, is that your body is always in balance. You have effector cells; these are the guys who like to fight, and then you have regulatory cells. These are the peacemakers. It's kind of like men and women. If they're in a pub or a bar, the men are more likely, if they're getting drunk, to get into arguments and fights, and the women are there to calm them down and escort them safely home. That's kind of like how the immune system works. And what then happens is that because of the damage that occurs to these regulatory cells here, especially because some of the surrounding cells have non-productive infection, it damages these regulatory cells and they then become dysfunctional. And what you then end up with, because this is where many of these people were beforehand, is that they had their immune system in balance. And because their immune system was in balance, they had no particular symptoms. That was what they were focused on at that time. Once you have damage to these regulatory cells, they then become out of balance and inflammatory processes increase, which would then lead to lung fibrosis. This is the pattern that I think that I'm trying to help people to understand, is that it's not as simple as just in terms of the spike protein causes these things. In many senses, it unmasks an already inflammatory process that is in place. A very important differentiation, and it helps us to understand a little bit more about what is going on. We have to try and find ways to protect the immune system from the continuous exposure to the spike protein, which dysregulates this immune system and causes it to have a problem. So as I conclude this section here, I'm just looking through to find a few other points around it, is that you had in this case, and I'll just show you what it looks like when they have inflammatory process. You can see down here, this is what it looks like with the fibrosis in the lungs on a CT scan, a high resolution CT scan. And this fibrosis, once it occurs, is not easy to reverse. You can try and manage the symptoms, but it's not easy to reverse it. And what they said in the discussion is that these cases highlight the clinical and immunological complexity of ASS, particularly its overlap with SARS-CoV-2 related pulmonary involvement, and raise important questions about the interplay between viral infections, vaccines, and autoimmune mechanisms. And just for the record, in order for somebody to get a paper published, just to show you that even when they're talking objectively about everything and they're recognizing that there's a problem, they have to throw this in at the end. It's important to emphasize that our findings do not diminish the importance of vaccines. Rather, they contribute to medical knowledge by underscoring the significance of a multidisciplinary approach and early intervention. If you don't put that in your paper, it is not going to get published. Just my thoughts. But that's essentially how it works with regards to these inflammatory processes. And this is why the autoimmune prediction is inevitable based on this characteristic with high circulation of virus. The challenge we have now is how can we manage this situation and reduce the risk in the longer term. So, yes, so I think that that's the end of my presentation. If anyone wants to have a quick chat, I'll try and see if I can put the link in the description. The rules are simple. Yes, you're allowed one question. Please don't make any inappropriate comments that will make us at risk of censorship. No swearing, no need to argue with anybody. Share your thoughts, ask your question. I usually love to try and see if I can help to add some clarity and to talk about it. So if anyone wants to join with me, just take a look in the message, and there is, oh, there is oh, it didn't go. Let me just see if you can see it. Oh, no, it doesn't seem as though this is working. Well, I'll tell you what, I'll try one other way of doing it. We'll see if this works. You'll have to you'll have to copy this or banner. Oh dear. I'm having some problems with my connection for some reason. So I'm not sure why. I'm not able to share that link. I'll try once more to just see if it works. No, it's not going through. So I apologize. I can't even share my banner to make it work. I have one idea I'm going to try and do here. Yes, I will try once more to just see if I can get this to work. And I think I have got it to work now. So hopefully, there we go. Yes, so if somebody wants to join, you can jump in and we can have a question or two. And we'll talk about things related to COVID and the COVID pandemic. So yes, so thank you again. In case nobody wants to jump in, thank you again for joining us. We are hopefully able to share important information and get insight into some of the conditions that are certainly occurring at this time across the world. The more information and understanding we have around the science, the better prepared we will be. These are challenging times and there are no easy solutions, but we do need to have an opportunity to be able to try and make a difference with regards to research. We need more people doing this kind of autopsy research and trying to see if we can make a difference here. Okay, we have a few people who have jumped in, and I'll try and see if I can add them to the stage. And as I said, when you come in, you can share your thoughts or make a question, and let's hear what we have to say. Here we've got Will Thompson. How are you, Will?
I'm great, Dr. Phil. I've been waiting
Excellent,
for two
excellent.
years to talk to you.
Excellent, excellent. Will. So listen, Will, we've been in discussion for a long time. You have raised some very important points about CD8 immunity. I thought that they were excellent points. But tell us what is it, a question or a statement that you want to make?
Well, you became the ambassador of nitric oxide over the
Mm,
last 8 months. So I want to tell you, it all started because Donald Trump didn't say inject bleach. He said we could try a natural disinfectant. And then a few months later, sanitized nasal spray came out that was 99% effective. And it's still never become popular. It passed phase 3 clinical trials. So
mhm.
when Geert van den Bosch is talking about getting antivirals for people who are immunocompromised, or people who are still worried that they don't have good immunity, there's a spray available. And my question was to you was, would you like to go into a campaign to try and advertise that? Because you talk
Well,
about humming, but you
yeah.
don't seem to know about the sprays itself that are available.
Well, I'll tell you my thought on it. Yes, I do know about the sprays, but
Okay.
the reason why I tend to say people should hum rather than use the sprays is because the sinuses, I'll mute you temporarily. The sinuses are more like a reservoir. And so if you when you put nitric oxide in, what then happens is that if you are, it's kind of like if you take a GTN spray. GTN is linked to nitric oxide. But in that circumstance, your body needs to have it in reserve rather than to necessarily be active as soon as it comes in. That's where I see the difference with humming. Humming fills up your sinuses with nitric oxide, and then when the body needs it, the body can then use it as appropriate, if that makes sense.
I absolutely agree. If someone gets infected, it gives their CD8 and helper cells a chance to get a memory update, and the nitric oxide can be used like the cavalry at the end in case it's getting severe. And
Yes,
overnight,
and
it takes
it,
out the
it,
viral loads.
it's a remarkable molecule. So thank you very much, Will. Much
One last
appreciated.
thing:
Yeah.
if the bird flu thing happens, it shows potential against flu as well. However, bird flu tends to attack the lower lungs. So the question would be, are you able to put something like nitric oxide into the lower lungs? And I've looked into it. It might be if that starts to happen in our future, that's the thing we can use to really help. I think we'd like to focus on that and make a bit of
Excellent.
money on the side.
Thank you, Will. Thank you. So, yes, Will is quite right with that. The nitric oxide is so simple, and this is why I tend to talk about humming, is that by humming, you fill up your sinuses, and then when you breathe, even it gets nitric oxide down into the lungs. I saw an interesting thing, and it made me think carefully that one of the reasons why we may have seen poorer outcomes with patients who were intubated is that they lost that ability for nitric oxide to come from their sinuses into the lungs. Just an interesting thought that I thought was relevant. Let's see, we've got one more person here. This is Kak. So tell me where you're from, Kak, and then ask your question.
Right, so I'm from England. I live in Lincolnshire.
Mhm.
Thanks for allowing me the opportunity to ask my question. I'm very grateful. Um, so, spike protein getting into the body in whatever shape or form um, and becoming systemic. What's your thoughts on spike protein once it enters into the gut and in particular into the microbiome and disrupt that whole process? Because my understanding from the research I've done, and you might correct me if I'm wrong here, is that the gut influences a lot of our immune system. So the spike protein interfacing or interacting with that microbiome can disrupt it, either an increase in production of bad bacteria or reduction in good bacteria, or a combination of both, which then potentially gives rise to a systemic distribution through the body from the gut into the, the immune system, which is basically, it originates from the bone marrow, in effect, the red T blood cells, whatever they are, that exist in, or stem cells that exist in the iliac crest area.
Yes, yeah, you're right on point with that. And when I look through my slides, so usually, because I've done so many slides over the years, this is what it can look like, is that we've got all of these slides here, and I literally will have the slide on the intestinal bacteria that you're talking about and the impact that it has. I don't have it right here at the moment, but oops, where did you go? 1 second. I'm going to bring you back on. I just have the wrong setting here. In a minute, I will bring you in. Yes, you're back again. Yes. So as I was saying, it depletes significantly the gram-positive bacteria, wipes them out, really important bacteria. It does seem to be able to get inside the bacteria and continue to replicate. And so this is quite significant, very serious in terms of the spike proteins. And one researcher I know is looking into trying to differentiate where the source of spike protein is coming from in some people. And they're trying to figure out if it's coming as well from the gut bacteria and circulating in the bloodstream. So this is, go ahead.
Just if I can add to it. So if you think about the way that we understand how much COVID is in the environment, is through the sewage tests that are done, and that's showing that there's COVID in circulation just about everywhere, just through analysing the sewage, which means that it's coming through that part of the human body that we just discussed. So if it's inherent in there through a period of time, that's where the problem should be addressed, because that's where it's most systemic. Now, if we then think about the causes there, the things that we're probably not allowed to mention on here, but the particular medicines that we are aware that have a positive effect, and those sort of parasitic type drugs that are common, hydrochloroquine for malaria, stroke parasites, ivermectin for similar sort of thing, parasitic type drugs, whilst they're geared towards or targeted towards animal populations, they're basically the same molecule that's administered into a human being. Now, nature in itself gives us loads of things that are available to us, that herbal type remedies which are available. And I understand that quite a lot of research has been done into these anti-parasitic drugs, as well as things like artemisia, which is basically sweet wormwood, which farmers periodically give their livestock to keep them healthy. So I'm rather surprised that I can only speak from my own personal experience, and I haven't been vaccinated, and I've got no intention of being vaccinated. However, I have periodically used sweet wormwood as a cup of tea, once a day, 5 times every month, and I haven't been ill with anything. Not a bit of a cold, not a sniffle, nothing. In fact, I lost 20 kilos in weight, and I'm 60 years old, and funnily enough, I put this out about the artemisia plant that is used predominantly in Africa for malaria purposes. And if you look again at the statistics that are available, which you no doubt have, which cover the COVID, epidemic and the number of deaths, etc., raging across the world. Well, what's the areas that have been least affected?
I
The African continent.
Yes, I'm going to pause you there. I'm going to pause you there, Kat, because there's someone else coming on. And so thank you very, very much. And I think that your point is really valid. And I do think that we have to reflect carefully on some of the herbal products that are available. I think one of the challenges that exists in terms of allopathic medicine is very often we don't just give a medication, we give a dose of a medication. And similarly, in the herbal sector, trying to work out some of the doses based on weight and so on can be a bit more challenging, but they do seem to largely be quite safe for a lot of people. But again, they can interact with medication for some people, but excellent idea. Thank you very much. Appreciate it much. Okay.
Thank you.
Thank you. And finally, we'll have one more here, and we do have to jump off shortly. And we've got Jeff. Jeff, say where you're from and what's your question?
I'm from Central Michigan, and my question is, oh, there's an echo. Okay. I have multiple health risks, and I was wondering, I have pulmonary fibrosis that was diagnosed after having been in the hospital from Christmas 2020 to mid-February, and then was on oxygen for an additional 6 weeks. I'm wondering, what can I do to heal up my lungs? Can I be healed from pulmonary fibrosis?
That's a very good question. Let me think carefully about this answer. So, when we think of what happens with the viral infection, so severe COVID, if you ended up on oxygen, can certainly trigger inflammatory responses in the lungs. And the lungs can get damaged. And that's when you have the fibrotic elements that can be put down in the lungs. From a practical point of view, once you have scar tissue forming, because this is technically what the fibrosis is, it usually doesn't disappear. So wherever you have scarring and fibrosis, it's usually permanent. However, what I think happens for some people is that you have to remember you have 480 million alveoli. And so even if a percentage of them were damaged, the lungs can then, it has a lot of reserve to then utilize more efficiently other parts of the lung. And the best way of thinking about it is that we can do a whole lung removal of someone, so they only have one lung, and yet they're still completely fine, not short of breath, able to manage. And so, if anything, I would say that rather than thinking of healing your lung, because if there is scarring and fibrosis, I'm not sure if that can be easily reversed, but you can try and find ways to bring in other aspects of your lung to optimize its function and therefore reduce the shortness of breath and the breathing difficulties in the long term. That really is quite a specialist question. So I wouldn't want to answer it on behalf of a respiratory expert, but that is my thought on the idea. Work on your breathing, do your deep breathing exercises. In a sense, nitric oxide can help to dilate some of the lungs. So doing as best as you can with what you have is probably a reasonable approach at this point. I hope that helps, Jeff.
Yes, it does help. Thank you very much. I appreciate all the help in all of these aspects in your research. You've been really helpful. And I've been studying, because of you, I've been studying microbiology and virology from MIT. I've been listening to their lectures. So I've got a pretty good working knowledge of what goes on with it. And I do want to mention that as for myself, I used to be a scuba diver and skin diver and have a larger lung capacity than most people. So it hasn't really caused a whole lot of problems because I have good lung capacity. I'm 65 years old now, and just 2 years ago, I was tested as still having the lungs equivalent to a 52-year-old. So I'm in good shape. And I was just wondering if there was anything I should be doing to care for my lungs and keep my lung capacity as young as it is now.
Wonderful. Great to hear. Thank you very much, Jeff. Have a great evening.
Alrighty, you two have a blessed day. Bye.
Okay. Bye. So thank you all very much for being with us. This is always very interesting to hear different perspectives, different questions. You can't always have a perfect answer for all the questions, but really appreciate you all joining in with me. So again, look forward to sharing more information with you in the near future. Have a great evening.